Well, welcome back to Hamilton Life. Did you know that 20% of women, 50% of pregnant women, and 3% of men are iron deficient? Well, that's what I found out, but I brought in the expert, Tyler Arsenault, who's a nutritionist here in Hamilton, to give us the sort of insight as to the problem with iron, because I know that a lot of people, and a lot of women especially, do suffer from iron issues that can make you tired, you just don't have the energy you want. So what foods can we get our iron from?
Typically the best sources of iron altogether are your meat sources. There's plenty of benefits in effects with vegetables and fruits. The benefits with meat are fewer. There's a lot more benefits with meat, but usually iron bioavailability is one of them. So when it comes to iron, meat is your best sources, eggs, dairy as well. Your vegetarian sources would include beans, legumes, tofu, or any soy basically, and dark leafy vegetables.
So soy has iron?
Yep. So your chard, your kale, spinach, that type of thing will also be very iron rich.
And why is iron so important for us?
Its main function is basically forming your red blood cells, and so red blood cells, their main function is to transport oxygen through the body, which is why when you don't have enough iron, you don't produce red blood cells properly, and you get that feeling like your day-to-day life is like climbing Mount Everest. You can't get a full breath. There's no oxygen supply going through your system.
You just constantly feel wiped out.
Yeah, so that's the main issue that's impacted when it comes to iron deficiency, is that lack of oxygen through your system.
So it's great to get it through natural food sources, but for a lot of people that's difficult, and especially if you are a vegetarian and you're not eating any meat whatsoever. You can take supplements, but you want to make sure it's as natural as possible so your body can absorb it, because that's really the key. You can take all the iron you want, but if your body's not utilizing it, it doesn't do us any good.
Absorption is one of the key issues. Going back to food for a second as well, a lot of breads and cereals and like grain products have also been fortified with iron, so that vegans and vegetarians have an easier time meeting their iron
And that iron's still good?
Still very good, yeah. Still very bioavailable. When it comes to supplements, one of the more common supplements that's prescribed or recommended is usually very high dose, sort of medium absorption iron. And the problem with that is that when you take an iron pill and you absorb like a small fraction of it, which is usually the case, you have this huge amount of iron left over in your intestines. And that's what causes, for a lot of people, gas, cramping, bloating, constipation, and all these different...
We don't want any of that.
No, so it's the most common complaint we have with people with iron is usually those types of symptoms.
Really?
So choosing an iron supplement that's like highly absorbable means that more of it's getting into your bloodstream, which is where you want it, and less of it's getting into your intestines where you don't want it.
And these are some of the examples here that will work for you?
Yeah, starting I guess from like the absolute best, which in trying to choose an iron is a bit tricky as well, because you want to choose one that does the job, doesn't cause any side effects, but gets your blood levels high, but without obviously the better ones are more expensive, so you don't want to have to pay more unless you need it. So in the case of the best one, there's when it comes to iron, there's two main types. There's one called heme iron and one called non-heme. One is basically bound to hemoglobin, that's your animal-based iron, and the rest are all your plant-based irons, which are called non-heme.
We need another segment to finish this off. Way too much information.
We'll try to go really fast.
I got to cut you off there, because we are honestly out of time, which is too bad, because there's so much to go through. But I think you brought up some of the key points there, Tyler. If people have more questions, they can give you a call, contact you at Full Circle. You guys are so knowledgeable. FullCircleHealthCare.ca. You will be on weekly, or every other week, I should say, on Hamilton Life. So, we'll continue to get through more of the questions that people have. And as I said, if you've got anything for Tyler, you can contact him directly.